Hi, everyone. Thank you for joining us. My name is Tristan Carlson. I'm with the United Corpus Christi Chamber. We still have about 10 minutes or so, or a little under 10 minutes until we're scheduled to begin. So just bear with us while we get all of our participants on the call. Thanks. Representative Hunter, can you hear me?
I'm here.
Still waiting on the rest of the crew. If I look horrible, sorry. I'm pretty sure I'm part of the COVID participants here on the call. So bear with me.
Good afternoon. My name is Lisa. Just to let you know, for Mr. Herrero, he's not in the office yet, but he should be here shortly.
Okay.
Thank you.
Hey Todd, if you happen to see any of our participants on one of the videos, just let me know what their name is, just in case I'm not able to find them.
I see Luis Moreno with, I believe, Senator Hinojosa's office.
Perfect. I just click to unmute. All right, they're unmuted now. So we're just waiting on Mike and John. You hear me?
Yeah, I can.
Great.
Sorry, I had some trouble getting in. My internet isn't working, so I had to dial in on the phone, which is always fun. Is everybody there? We close?
We're still waiting on one, just Mike Toomey.
Okay. Well, if we have to, he's the last speaker, so we can start without him at 2.
Mm-hmm.
Try to keep it on time.
It's on the line. If you mute yourself on your end, you won't be able to unmute yourself. So just shoot me a message. I'll be able to unmute you.
Once they start talking, Tristan, I will mute myself so you don't get all the background noise.
Okay. Todd, who's with Senator Hinojosa's office?
Two o'clock, should we start?
I'm not sure. Representative Hunter can hear me.
Oh, okay. So we have Senator Hinojosa and Representative Herrero on the line now.
I believe we have a senator, but it's not under his name, so I'm trying to figure that out right now.
Okay, we can wait a couple minutes.
I believe Mike Toomey is on.
Great. Sounds like
Can't hear
Todd's
you,
on,
Andy.
too.
Working on Todd's right now.
Can you not hear me?
I can hear you.
Yes.
You might want to unmute Angie. Go ahead, Angie.
Okay, can y'all hear me?
Yes.
Mike
Yes.
Toomey's on, but you guys can't hear him, so. I think he's been muted.
Mike can hear us. We can't hear him.
I just need to know his Zoom name, or did he log in via a phone number?
He's just asking if you can unmute him.
I can't find him. Senator's office, I can unmute them. It's not. John, you can hear me, right?
Okay. Do you want the landline phone number?
Yes.
603
Say it again.
515 3429.
Can you hear me now? This is Mike Toomey.
There
Yeah.
you go.
There you are.
There we go. Great.
All
Be
right.
careful, old Bob Perkin can hear you.
Oh, you call, Bob. Sorry, I've been fighting alligators, but I haven't forgotten about you.
Okay, why don't we, Tristan, I think we should get started. Did you find Senator Hinojosa?
I have not.
Senator Hinojosa is on, but he's been muted.
Okay.
Does name or phone number? Let's see, is this?
Can you hear me now?
There
There
you
you go.
There you go.
All right.
Okay.
All right.
All right. I think we're ready. This is John LaRue at the United Chamber, and I'm not going to spend a lot of time with introductions. We know the members. You seem to have some feedback there, so if you're not a speaker, if you could mute yourself. Speakers shouldn't mute. That's better. Well, not really. Anyway, I want to thank our delegation for their continued vigilance in helping us get through this difficult time. And we've had some obvious setbacks the last 2 weeks, some changes in both statewide and at the local level on our opening process. And what we're going to do is have start with Senator Hinojosa, then Representative Herrero, Representative Hunter, and then Mike Toomey from the governor's office. So you guys don't have to pass it back to me. Just hand it off to the next one, and we'll try to get everybody out of here in 1 hour. So Senator Hinojosa, please go ahead.
Thank you, John LaRue, and thank you, the United Corpus Christi Chamber of Commerce, for putting this webinar together. I must say that seems like besides the coronavirus, COVID-19 challenges, we also face technical challenges sometimes on these conferences. But let me first start by saying that obviously we are facing a major crisis, not only in our state, but throughout our nation. The number of virus infections have increased tremendously. I think here in Texas, we passed over 8,000 yesterday. And when Governor Abbott first opened our economy back in April 27, he took a very cautious, very measured approach to opening in our economy. And quite frankly, he didn't do this in a vacuum. He had advisors, medical doctors, health experts guide him through this process. And it seems like after Memorial Day, things seem to all of a sudden fall apart. In that now we again have a tremendous increase. It was going down at one time, pretty much under control, but then all of a sudden it exploded as we went into phase 2 and phase 3. But part of the issue is that people in general, the public, thinks that this COVID-19 is over. And they're out there in public not following social distancing, not covering their mask or covering their face with their mask, not avoiding large crowds. So we, as a state, also need cooperation and help from the public to understand that this is a very serious situation that we're facing. Governor Abbott has now issued the next order that he issued to sort of step back and go back to phase 2 and trying to control the spreading of this pandemic, this virus. Now our bars are being shut down again because there seems to be a hotbed for the spreading of viruses of COVID-19, but also our businesses. Now they can be open only at 50% capacity. Our hospitals, quite frankly, are pretty much at capacity also. So we are facing a situation where we have an unseen enemy, if you will, that is a fast-moving target and mutates. So we, as part of the state, also need to manage the situation where we have to sometimes modify the executive orders to meet the situation at hand. So for us, we are continuing to pour more resources in the different hotspots from the hospitals that are really in many areas and regions of the state are now at capacity, to different nursing homes that still need help. And now we're dealing with our state school. I know in Corpus Christi, Todd and Abel, as you well know, we had about 22, 24 patients at the State Sport Living Center. We had approximately 24 employees also. So we are putting our plans in action to try to control these viruses. But again, I cannot overemphasize that for us to be successful, it has to be a united effort. It is very unfortunate that many times the situation, wearing a mask, has been politicized. Well, this isn't about politics. This is about health, protecting the public. So we all need to cooperate. And again, as we look at the numbers, look at the data, I think Governor Abbott will again adjust the order depending on the type of feedback we get. It'll be another probably week or 2 weeks before we get the real data of where we are now. While we may have 8,000 plus new infections, it also sometimes takes a while for that to see how much is spread, how many of them have to go to the hospital, and how much of them need to go ICU. So these are real challenges that we're facing today. So this is a real moving target. And again, we'll continue working together as a delegation with Governor Abbott and his staff to try to focus and target those areas that we need to address in trying to pin down and provide at least stop the spread of this COVID-19. Todd?
I think it's Abel next. Abel next.
Yes, thank you. Can you hear me?
Yes, we can, Abel.
All right. Thank you, Senator. Thank you, Chairman Hunter, everyone else who's on the call, John LaRue. I want to reiterate the points that the Senator made, and I've got some notes in front of me, so bear with me as I look down. But ultimately, what we have to do is follow the CDC guidelines, making sure that we keep our social distance, make sure that we wear facial masks, make sure that we wash our hands, make sure that we use good hygiene, make sure that we do everything that we're supposed to do to help limit the exposure of the COVID-19. There's a lot of decisions that are being made, not just at the state, federal, local level, but also at everyone's employment. And so we've been getting a lot of calls in our office about either calls from employers, calls from employees, and that would be from private employers and governmental entity employees. So one of the things that I want to make sure that anyone who's out there that is listening that is an employer, there's different provisions that would apply to you or not apply to you depending on how many employees you have. So the Families First Coronavirus Act, for example, the federal act applies to employers that are 500 or more employees. And so those are provisions that, I say that the other way, less than 500 employees would apply to you. And that's important because under that federal law, that allows employees to be able to have up to 80 more additional pay time off of sick leave. If you're 550 or less employees, you can ask for exemptions, but those are more specifically requested upon an individual basis. So I say that because there's a lot of moving parts to this. In addition to asking you to do your individual personal responsibility to adhere to the CDC guidelines, there's also provisions that would apply to you depending on what type of employer you are, depending on the number of employees you have, and then also depending on what type of classification your employees are. For example, if you have a critical infrastructure employee status, for example, even though individuals may have been exposed to someone in the workplace, so long as that critical infrastructure employee has not shown symptoms under the CDC guidelines, that individual is still allowed to perform their job duties at work, provided that you have the personal protective equipment, and that would be gloves, masks, shields, gowns, to the extent that that is something that is required for that type of business. But I say that only because, again, there's a lot of provisions that are in place. When you look at the local county provisions, I'm glad that the county has limited access to the beach. It's important, especially during these either family, personal events like birthday parties, reunions, graduations, things of that nature, that we be more cognizant of what we're doing and the fact that we're getting people to congregate. And in some cases, you have individuals that are asymptomatic, meaning they're positive of coronavirus, but they may not be aware of it, or and they wouldn't have a reason to know of it unless they were exposed to someone for a certain amount of time with that individual within a close proximity without any sort of protective equipment. But then they now become carriers of the virus. And so what we're finding out from a lot of individuals is they did not realize that the person that they were having dinner with was actually positive for COVID, and they themselves didn't know until after the fact. So a lot of the numbers that we're starting to see today, like the 300 plus positive cases that we had yesterday in Nueces County, you could actually trace back anywhere 2 to 14 days ago of when that exposure occurred. So it's real important. I want to emphasize again that it's important that we social distance, wear masks, use all the CDC guidelines to protect ourselves, our community, our families, and our loved ones. And especially now as the school year is going to start. I know that some school districts like London and Toloso Midway start school in less than 2 weeks, or at least are scheduled to. I know Toloso Midway, for example, which is those are year-round schools. Toloso has decided to postpone its start date to August. And so part of the reason is that we have not received, and they haven't received, guidance with specific enough as to what would be necessary for in-classroom settings from the Texas Education Agency. So I know that all of us as a delegation are working together to make sure that we provide the answers to you as employers, you as community residents, but then also our school districts and our children. So all of those are matters that we're working on collectively to make sure that you have the information that you need to be able to make informed decisions, either as a loved one who may have to send your children to school or may decide to do remote learning. That's another option that I understand that TA is going to allow school districts to have. And so decisions whether you make as a loved one, a parent, an employer, or as an employee. So again, moving parts, very important to stay engaged. And I want to further emphasize to adhere to the CDC guidelines. All those that sound repetitive, but they're very important. Social distancing, wear a mask, good hygiene, wash your hands, 20 seconds. I went to a Catholic church to pray, obviously, but and it said the Catholic prayer is different than all the other CDC guideline prayers. And for Catholics, for example, it was to say that Our Father, Hail Mary, and other prayers that would last more than 20 seconds. So whatever it is that you find as a means to try to ensure that you are following these guidelines, kids sing songs, whatever you may want to do to help make sure that you're finding a positive way to implement these practices into your everyday life, it's really important for everybody. So, Chairman Hunter.
Thank you, Abel. Let me take a little different approach from Senator Hinojosa and Chairman Herrero. But first, so everybody knows, Senator Hinojosa, Chairman Herrero, and I work as a legislative delegation team. Right now, the focus is on public health and safety. And we work with our local government, state government, federal government. That's the focus. Teamwork to get us out of this issue. Now, I want to thank my legislative delegation. I want to thank the United Chamber for getting information out. But I want to also thank the governor of Texas, who's had to make a lot of tough decisions. And it's easy to criticize, but they're tough decisions. And I do want you to know that the governor has reached out to our area and has plugged us in as a delegation to what's going on. So from communication, I wanted everybody to know that up top. And the United Chamber, along with the other chambers, have been excellent in getting the information out. Now, I'm going to hit on some things that you need to know. And I'm going to tell you something right off the top. Let's quit sugarcoating this. It's bad. I think one of the healing processes is just to come out and call it what it is. We're sitting here with high skyrocketing cases, hot spots. We're all of us at home, business, drinking out of a fire hose. So we've got to recognize that we're in a pandemic. Second, there's nothing wrong with wearing a mask. I even color coat my mask with my shirt. Social distancing, let me tell you something. What's the difference? If you don't want to catch a disease, stay away. The guidelines from the CDC, from the state, are just common sense. If you don't want it to spread, you want to control or flatten the curve, follow those social distancing. Whether you agree or disagree about a rule, it's just common sense. The data, let me tell you something, the data isn't going to be much good this week or next. Just be ready. I want everybody to know the data trend is not going to be positive. Now, why do I say that? Because the best way to heal and cure is to just be open and honest. I see Libby on here. One of the things that's pushed me is one thing I've learned from coronavirus. I want complete open government transparency on information. I've learned that. And I'm going to be pushing legislation that is completely transparent. I don't like seeing people sit outside a window with their grandmother or grandfather. I mean, that looks awful. I want to know if people are being affected, and stress affects all of us. So transparency, openness to all is important that we've learned from this crisis. What happened this week? Let's just call it like it is again. No sugarcoating. The governor issued an executive order. The executive order said no elective surgeries in Harris, that's Houston, Dallas, Bear, San Antonio, Travis, Austin. Those are big towns. Then all of a sudden, this week, 4 other counties were added. Webb, Laredo, Hidalgo, the McAllen area, Cameron, Brownsville, and Nueces County. What's that message? We're a hot spot. We're one of the 8 hotspots. And isn't it interesting? 4 South Texas counties were added to the executive order. So my message is, it's serious, but we can win. But we got to use some common sense. Let me tell you some other things. I never thought I would become technologically competent, but the pandemic has led me to virtual, remote, and everything. But let me give you a caution that was let out this week on cybersecurity. All of you right now that are listening, can I see you? Somebody takes a picture, they can focus on that picture behind you, that book behind you, all your certificates behind you, and use that. So one thing I've learned is when we do virtual, be careful on what's behind you, because that information is being gathered. from others. And sometimes we take a snapshot, that background. That was brought out this week by cybersecurity resources. So be sure and be careful when you're doing virtual calls. Governor announcements. Hospitals. $2.6 billion he was able to get in federal funding. That's pretty good. Yesterday it was announced $9 million for infection control at nursing homes. It's pretty good. And by the way, if you listen to the city and the county, there is a nursing home hotspot going on in Nueces County right now. Also, unemployment rate increased today, and it triggered an additional 7 weeks of extended benefits in Texas. So be ready. We are going to have an economic challenge, and we should say it now. Education. Abel said it. The senator knows. Right now, the governor and the Texas Education Agency are waiting to see what this data says before they give the health guidelines to your secondary schools and colleges for in-classroom attendance. And yes, they're being delayed, but they're being delayed so you get the right message. They are waiting, and they've delayed that until they get the information. Also, I want you to know, I think we need to quit talking and start walking. When you've been placed in a pandemic like this, we get cabin fever. We're enclosed. We got rules. We got regulations. We're hearing negative. We got to realize there's some issues out there that need some attention. Domestic violence, human trafficking, mental health, education, suicides. I want everybody to know on this phone, I got contacted today by non-college students, that's secondary, to try to please help in getting the word out on suicide prevention and education. Let me tell you all, it doesn't matter what age you are, the coronavirus is impacting us. These are real issues. And we're doing everything we can to get the resources out. You know, we got hit in the coastal bend by a hurricane in 2017. Now we got hit by the pandemic coronavirus hurricane. Now, there's one good thing for all of you all listening from the coastal bend. We've weathered that storm, and we're going to weather this one. We're going to survive. But my view is lay out the facts, lay out the data, lay out the statistics, because the only way to tackle them, the only way to heal, and the only way to do good is put it out there, and by gosh, we'll succeed. Now, it's my understanding, so all of you know, that the governor, because 4th of July weekend is coming up, will probably provide some new announcements. It's already on social media, but there'll probably be some new announcements coming. You know, the gathering rule, mass gatherings, was recently changed. What the governor has done is reduced the number and tried to make sure local governments can provide the guidelines for this. Some people say, oh, why is that? Well, the reason is what happens in one area of the state may be different than another. So the gathering rules have been changed. But I do believe you're going to hear some new rules probably coming out so we can get our hands around this virus in the next 2 weeks. So that's some information where we're focusing and information that we're looking at. And I wanted to get that out this week. Now, our next speaker, I want to let you know who he is. The senator, myself and Abel know him very well. Some of you, like I see Bob Perker, is a longtime relationship. This individual has supported the Coastal Bend. Our next speaker, and I'll introduce him real quickly, is Mr. Mike Toomey. Mike is currently the Chief Operations Officer of Governor Abbott's strike force. And if you all remember, the strike force was created of medical folks and business folks to help get Texas opened with health and safety standards. So we've got the head honcho. And the reason I bring that up is he cared, and the governor's office cared, to give us the head of the strike force. That's a compliment to our area and certainly to our chambers of commerce. By the way, Mike used to be the chief of staff for Governor Perry, chief of staff for Governor Clements. He's a former Texas House member. He's an attorney. He's a very, very strong family person. He has a very, very lovely family, wife and children. I'm just glad that the state of Texas cares, and we're not always left out. We got people that are coming down here to help us. And so at this time, John, I will turn over the presentation to Mr. Mike Toomey.
Let's see if y'all can hear me. Can you hear me, Todd? Can you hear me?
Yes.
Good. Thank you. Thank you for that introduction, and thank you all. I'll make a few comments and then answer questions. First of all, I want to compliment your delegation. They are great. They are great to work with. The governor appreciates them very much. They're doing a great job for you, so you just need to know that. I don't disagree with anything any of your legislators said. They're right on. This surge we're having, I think everybody pretty well knows it is a majority of young people under 40 that have just agreed amongst themselves not to follow any rules, distancing, masking, anything. And as someone already said, this virus is highly infectious. And by our latest research, 40% of the people have it and they don't know it. They're asymptomatic. And so you can't totally blame them. They don't feel anything, but they're transmitting the virus. It makes it particularly bad. I believe that the governor did the right thing in opening the economy the way he did, cautiously, slowly, but the evidence confirms it now, because those states that waited, like California, are still, California is just, the virus is rampant there. And it's because whenever they open, the people that have been cooped up, they just aren't following the rules, and causing a large part of the cases we're seeing now. The governor, even in light of these bad numbers, he said today it is an absolute last resort before I want to shut down the economy again. He doesn't want to do it. He wants to try everything else. I wish I could tell you what he's going to do this afternoon. I can't. But he's going to make a major announcement shortly, and about getting ready for 4th of July. So, and what's going to happen. So watch for that, I'd say, in the next hour. I apologize for the delegation. I was hoping it would be done before this call, but it didn't get done. So, but I believe he's going to do it. He's still going to do it today. I do have a couple of requests, and I'll answer questions. We do need help from local officials. I'll give you an example. Local officials all over the state had the ability to report violations of these bars. Protocols say that the bars were to serve people only when they're seated, for obvious reasons. You want everybody drinking and hanging out together. Masks are hard in a bar or a restaurant. Obviously, you're eating or drinking. So the key was not serving people if they weren't seated. And you all know that from, just from knowing other people that have talked about it. It wasn't followed. We had 7 cities that during a 3-week period actually complained to the state, the TABC, about violations, and each of those only did one. I'll say this: in the cities that had the hospital problems that we started out with, San Antonio, Austin, Dallas, and Houston, 3 of those had no violation to report. I'll say this: on 6th Street in Austin, not one violation for 3 weeks. So without knowing who the good bar owners are and the bad bar owners are, the governor had no choice. He had to close down all the bars. So one of the requests is that y'all all help us, the chamber and the legislators, to help the enforcement of these things. Restaurants are still required to serve people seated. If the governor does open bars one day, we need the people to comply, and we need to know about it. We all have to, pull together to help stop this virus. And the other request is tracing. We've gotten some letters from some mayors. All of the major local governments do their own contact tracing. The state doesn't do it. We've got a system that we're going to try to get all the data interfaced with us, but it's still done locally. So if there are problems locally, we need to know about it. If hair salons are not following the rules and the tracing shows it's employees there or restaurants or whatever, we do need to know it. The governor's willing to do something about it, but the locals have the Army that can report those to us, so we can address them individually and not have to do something globally like we had to do with the bars. So those are 2 areas right now that y'all could help us with as we go forward. Oh, final comment. Yes, this is tough right now. The numbers are up still, but we have school. Universities will go back. Fraternity parties will be raging. Sorority parties. And then we have flu season. So this is going to be with us for a while, and we all need to pull together and try to get these young people in any way we can to follow the rules. Todd talked about distancing. That is number one. You don't really, a mask is not much use to you if you don't get 6 feet with anybody, with anybody. And then if you have to be within 6 feet, wear a mask. So we need your help locally to try to get these young people to follow the rules. It's been tough. I'll stop there and answer the questions that you have.
I think Todd and all our speakers. My name is Christi Cross, and I'm with the United Corpus Christi Chamber. Before I start, I'm going to have all of our speakers so that answer questions you may feel obliged to. And for any of our participants on the call, if you have any questions, go ahead and send them in the chat, and I will hopefully be able to get Mr. Toomey, question for you first. What exactly is the governor looking for moving forward that would make him confident enough to loosen these new restrictions? Is there a specific number of percentage drop he's looking for?
I was having a hard time hearing that. Todd or Abel,
Yeah, we
y'all
can't.
both had strong voices. Could y'all tell me that?
No,
what
we
the question
can't
was?
hear. We can't hear the question.
Okay. Can you hear me now?
Yes.
Yes, Mike can. Yeah, try again.
This was for you, Mr. Toomey. What exactly is the governor looking for moving forward that would make him confident with the new restrictions? Is there a percentage drop that he's looking for?
We can't hear you. You're breaking up.
Yeah, he needs to talk a little louder or get closer maybe to the mic.
I think part of the question, Mike, is something along the lines about what is their governor looking for certain signs or certain things and making his decisions or something to that effect. I guess the question is, what data is the governor looking at in making his decisions? It's my assumption of what the question is.
Well, I heard you talk about what data the governor's looking at. Is that generally, or are you wanting to know specifically what he looks at?
No, I think it's general.
Well, he first and foremost is hospital capacity. That's what he looks at. He gets 2 reports a day on hospitals. He gets it from all of the trauma service areas, and so I'll tell you what it shows today for Nueces, for Corpus. There were 10 lab confirmed patients from the previous day. The bad news is you've had an 84% increase in COVID hospitalizations in the last 5 days. 35.6% of your ICU is occupied by COVID patients and 15.5% of your hospital generally. And you're in the average statewide for COVID hospitalizations is 16.2%, so you're slightly less than the average, and you're right on track for the average in an ICU unit. The average statewide is 35%. So he looks at that foremost. He does look at positivity, the cases can go up, and the cases can go up a lot, as long as we have hospital capacity to take care of the people that need it. So there's plenty of PPE now, and I know y'all needed some, and I think we got it to you in the last week. So we're just trying to stop this flow we've got right now, and then I think there'll be an announcement today is we got July 4th coming up, and we can't have another resurgence after that with these young people on beaches and parks partying. So we've got to take strong action, I guess, is the answer.
Thank you. This is Ginny Cross with the United Chamber. Tristan's having a hard time getting through, so I'm going to take over the questions. The next question is there a concern that businesses who make the majority of their sales off of alcohol are being unfairly affected by this executive order?
I think the question was it unfair for those businesses that were following the rules to be closed down, basically bars? Is that correct?
Yes, sir.
Yeah, it was very unfair. But as I indicated, there was no way to determine who the good ones or the bad ones, because we hadn't had any reports of the 24 bars that were suspended. We had 7 of them are only based, as I indicated, from reports from the locals. By the way, none from Nueces. We did not get a single report of a problem with a bar. As I said, Dallas, none. Austin, none. It's just shocking to me, living in Austin, that there was no violation on 6th Street for the last 3 weeks. Clearly there was. So, yes. And I hope that the numbers come down and the bars can open, but we have to have local assistance. The local enforcement on the alcoholic beverage code is locally, and they have to be able to give us the information on ones that are and are not following the rules when we come out of this. It's absolutely critical, or we won't know. And that applies to tubers, it applies to anything, hair salons, it applies to gyms, it applies to anybody. If people are not following the rules, we need to know about it, and y'all need to know about it.
Understood. So the next question is for Representative Hunter. Do you support the governor's decision to temporarily halt elective surgeries in Nueces County, among others? And if so, how long are you comfortable with that being in effect?
The answer is I support the governor. I mean, we got 8 counties. He's provided the medical, so we follow his orders. How long we rely on the governor's strike force, who basically vet these rules. Now, I know that it's a burden on those 8 counties, and it absolutely is a burden. But they have the strike force, and if the strike force is going to vet them and the governor's going to come out with the orders, we're going to need to follow the governor. We're right now in a hot spot, and we're one of the 8. And if we're one of the 8, it's kind of hard to argue why a hot spot should be given any different treatment than the other hot spots. And then the other problem is, it's my understanding, and Mike, you may need to explain this, we are a county that may need surge teams. And if you have surge teams to get control of the hot spots, then that could happen here. And Mike, you want to explain to them what the surge teams are?
Sure. And there was, in fact, there was one instance where in a meat plant there that they actually called and asked us to send our surge teams down to do testing and to help stabilize the situation, which we were happy to do that. Early on, there were problems in nursing homes. Obviously, I think you all know, but 75% of the deaths are people 65 and over. So nursing homes was a problem. And so we sent the National Guard in to disinfect the nursing homes. We tested every nursing home resident and employee of a nursing home to help contain the situation. And then now going forward, if there are particular problems, we'll go back and do it again if we need to. So, and we've started to work on the assisted living centers. So it's been the meatpacking plants, and then jails and prisons have been a horrible place where the virus is just spread. So those have been the 3 really tough problems that have really added to the numbers. And the positivity in the meatpacking plants is high. So early on, that hurt because very few people died there. They're generally young and strong, but working in that kind of situation, the virus is spread like wildfire.
If I may add, Todd and Mike, one thing also on that decision, my understanding was that the Texas Department of Emergency Management, TDM, had hoped that hospitals on their own, based on the increase or hotspots, if you will, would see that it was a necessity to hold off on elective surgeries. But obviously, there's a financial reason why they would want to hold off as long as they could. But given the increase and spike in numbers, the emergency management team, the governor, obviously, in the data that he's looking at, like hospitalizations capacity, ICU capacities, if you will, has to make a decision for the best interest of the community as a whole. And so everyone is experiencing difficult decisions, both financial and personal, as a result of the COVID-19. And in some cases, there are things that we have control over as individuals or companies, et cetera. But in some cases, it's a matter of life and death for the community as a whole. So I agree with Todd in supporting the governor's decision to expand the holding of elective surgeries to include Nueces County.
Thank you. Mm-hmm. And I would say there was a lot of squalling before he did it, but obviously, based on the numbers and the increases in hospitalizations, people coming in was the right thing to do because they had to make room for, they had to make room for these people that are infected.
And this is going to be our last question, but it's one we'd like to hear from everyone on. We recently held a webinar with Texas A&M, Corpus Christi, and Del Mar College, where they shared their plans to reopen this fall. Both learning institutions shared their intentions to hold in-person.
Okay.
Jenny, we lost you.
Can you hear me?
Yeah. Did you get the question?
You lost a lot of her last part of her question, I think.
Yeah, I think we're all watching with bated breath. let me just start the discussion then on colleges. I'll try to take a stab at it, and then Abel and Senator and Mike, you can jump in. Look, colleges the rule generally is the colleges set their rules and regulations. The presidents of the individual universities have a lot of oversight. Texas Education Agency oversees the secondary schools, but the individual superintendents and school boards have control of a lot of how they operate. What we're seeing is there's a discussion of, if you go to school at whatever, to go either online, go remote, and if you go in class, social distancing and the plexi shields are being looked at, which they're doing on the House of Representatives floor. And they're talking about capacity levels, like 30 or 40% classroom capacity. And as well as extending classes during the day, as well as on Saturdays. And so these are the criteria that are being looked at. However, because of what Mike Toomey indicated, the data recently has surged. And yes, Nueces is in one of those 8 counties. And yes, we have some different impacts than others because we're in a hot zone. So statewide, they have delayed in-class education health guidelines to see what happens, really, I think, about 4th of July, so it doesn't repeat Memorial Day weekend. And then I think once they feel the data has been looked at, you'll have some announcements on in-class room guidelines with health, safety, social distancing. And that's what my understanding of where we are, what they're looking at. But other than calendars like Abel talked about, I think the in-class is still it's still forming and still developing.
Yeah, Todd, and I just want to add to that this is a decision that is being made by all presidents of universities across the state. My daughter, who attends UT, is getting constant updates, and it changes based on what the coronavirus is doing in any one given area. So for example, for UT, they will start in August, but they already know now that their fall semester would only go to the day before Thanksgiving. Once Thanksgiving is here, they're not going to be allowed to go back into classroom settings until the next semester. And so because there's an increase in spike COVID cases, the number of classes that they have available, let's say 11,000, they ended up increasing 1,500 more classes that were going to be available online because of the increase in COVID-19 cases. So what was going to be 1,500 cases available online now is up to more than 3,000 classes available online, and their day is going to be extended anywhere from 8 a.m. to 8 p.m. And so that's part of figuring out where is a certain class that teaches at a certain time going to be held in such a way that if students decide to attend in person, that there's enough capacity in the classroom to allow for 6 feet of social distancing. So there's a lot of logistics that go into play about the decisions that are being made. But in every case that I've heard, the universities and even school districts are allowing for distance learning.
Absolutely. And another thing, Abel, on the mask issue, I believe that is in the jurisdiction of the individual campuses. I think, as you and I know, and the senator, they can do their own individual mask inside their campus.
All right, so you know where my money is going. It's a UT, but anyway, UT, for example, has already declared that in any university building, you will be required to wear a mask. Unless, let's say you're a professor and you're in your office and you're the only one in your office, then you wouldn't be required to wear a mask. But otherwise, if you're in a building owned by the university, everyone entering the building is going to be required to wear a mask.
Would any of our other speakers like to comment on this?
No, this is Mike. I agree with everything that's been said.
Mike, and thank
I
you
do
for your
think that-
help. I want to say thank you to Mike Toomey and all the task force, because they've been extremely responsive to the needs of our community as those have come up. And they're not 8 to 5, if you will. They're on weekends and odd hours and things of that nature. And Mike Toomey and his group have always been readily available and responsive to the needs of Nueces County and the surrounding areas.
And we'll continue to do that. Thank you.
Thank you.
Well, thanks to everybody.
Yes, I really just want to thank our speakers today for joining us, taking the time. We really do appreciate it. Our members really are always interested in hearing from you, and it's been great information with so much going on right now that it's really valuable to our members. So with that, if no one has any other closing remarks, we will say farewell and tell everybody to have a safe and joyful Independence Day weekend.
Very well. Be safe, everybody.
Bye.
Bye-bye.
Bye-bye.
Bye.